Hello, everyone. I'm Jonathan, Chief Exec of London's Air Ambulance. Many thanks for all the questions you've sent in. We've asked you if you had any questions for our Medical Director, Tom Hurst, and you certainly have, and we're going to go through as many of those as we can right now. Tom, thanks ever so much for joining us. I warn you now, we've got a lot of questions from people for you. And so are you good to go, Tom?
Yes, all good.
Excellent. Right. Now, so I'll start you off some simple ones.
Yeah.
What are the operating times? And do we ever fly anywhere other than the Royal London Hospital? That's coming from Chirag.
Yeah, so the operating times, we are a 24/7 service and we use the aircraft from 8 in the morning till sunset. And then we move on to the car operations. We do fly to other hospitals. So we mainly fly patients back to Royal London Hospital, but sometimes, for example, we'll fly burns patients to a burns centre. And we also fly to other hospitals to pick up our team when they've moved patients by road, for example, to the other major trauma centres.
Okay, thank you very much indeed. Now, I've got two questions come in, pretty much the same from Steph and Chanel, which is about where we land, which is around what's the sort of most inaccessible job you've ever had, and what's the sort of smallest space that the helicopter would tend to land in?
So the smallest space the helicopter can land in is essentially a sort of a square tennis court area, so about 26 metres by 26 metres. And our pilots are superb at finding those little sites in and around London and getting us into them. I can't think of a sort of specific tightest ever site because, to be honest, the pilots do such a good job of making it feel safe and speedy that there aren't any that stand out as particularly inaccessible. The one that stands out as particularly unusual was when we landed on the banks of the River Thames at low tide, quite a long way upstream, to help a gentleman who'd fallen off the wall onto the banks there.
Okay, thank you. And I know, Tom, you've sort of worked with a number of other air ambulances. I'm being asked the question here: do we ever fly over Kent? But you may have done that for KSS. Is that fair?
Yeah, I mean, I didn't fly for KSS. They're one of the services I've not had the privilege of working with. We do fly out to Kent occasionally if there's a job that's sort of on the Kent-London border and Kent Air Ambulance are unable to attend because they're with another patient. They might ask us to go as what we call a mutual aid mission. So yeah, for sure.
We've had lots of questions, Tom, about becoming a doctor, how you get to be where you are today. And just to take a step back from that, so what are the main roles? So in the helicopter, you have a doctor and a paramedic, and it'd be worth just explaining what's the difference between those two roles.
Yeah, great questions. So in terms of the roles, you're right, there's a doctor and a paramedic team on all of our missions, whether that's by road, in the car, or by the helicopter. I mean, doctors and paramedics obviously come from different professional backgrounds, and they bring similar but different skill sets. And I think we're very strongly of the view that the two professions working together, bringing the sort of medical hospital-based expertise of the doctors and the sort of operational pre-hospital medical expertise of the paramedics is the best way to deliver the sort of interventions we deliver for the most critically injured patients in London.
Great, thanks on that. That came in from Zach, and Barbara sort of led on with that, was a question saying, so what exactly are the sort of interventions that a trauma doctor would do?
So we always think of them as being delivered by the team rather than just by the doctor, but we can do pretty much everything that would be needed in the emergency department of a hospital. So we can provide emergency anaesthesia, we can put people on a ventilator, we can give blood transfusions, and in particular, circumstances where it's really life-saving at the scene, we can provide some surgical interventions. Particularly, we do open chest surgery where patients' hearts have stopped.
Wow, and I think Samuel's got a question coming in that's leading on from that, saying, do you think we'll ever see pre-hospital ECPR performed on the streets of London, as we had in Madrid and Paris? Now, I suppose the question sort of leading that is, what would be pre-hospital ECPR?
Well, pre-hospital ECPR is what's called ECMO, so a sort of heart-lung bypass machine used to provide resuscitation for people whose hearts have stopped and can't be restarted by conventional means. I think the answer to the question is basically a yes. And if people want to know more, they could Google ECMO sub 30 and you'll find out about some trial work that we're doing in this area.
So Tom, going right the way back to the start, have you got any advice for medical students who are maybe at the sort of earlier stage of their careers, who eventually want to end up working in the pre-hospital environment?
Yeah, I think that the first thing to say is people need to, work hard and focus across all of the curriculum, because what we look for, one of the things we look for in recruiting people to the service is people who are strong across the board and they're high performers. So I think that although there are lots of opportunities to get involved in pre-hospital care, education at an early stage of your career, it's also really important to focus on nailing all of the basics and becoming a strong, well-rounded practitioner.
I suppose a question for me, actually, Tom, at what point in your sort of career journey did you decide this is where you wanted to go into? Was this something from right at the very early stage in terms of your medical career, or was it a journey that you went on?
Well, it was a bit of a journey. It wasn't early, so it wasn't during medical school years, if I'm honest. I think during my medical school years, it wasn't something I had any awareness of or visibility of. I knew that I was drawn to the more acute end of healthcare, but other than that, it didn't really feature for me. And the sort of turning point for me was being brought along by a consultant to a major incident exercise on an airbase as a junior doctor, and sort of suddenly thinking, wow, you can be involved in this sort of stuff as a doctor as well. And one of the things that I always commend about a career in medicine to people is the breadth of things you can do.
Wow. Now I've got a couple of questions here from Scott and Harry, which I'll probably take, actually, Tom, if that's okay.
Yeah,
sure. Around the funding of the organisation. So between you, you've both asked, why are we a charity not funded out of the normal tax system in the same way as the NHS? And why, we do get asked quite a lot, why don't we receive government funding? Now, we do, in so much that Barts Health contributes our doctors to the service. The London Ambulance Service provide our fantastic paramedics. And we, the charity, bring a lot of logistics, a lot of the helicopters, the cars, some of the equipment. So it's a real tripartite relationship. So we work in partnership, but the vast majority of funding actually is raised by us, and we're very happy to work in partnership with these organisations, but also retain that degree of independence. And if you speak to any of the 21 air ambulances out there, they're all very proud that they're a charity. And we all very much feel that we are commissioned by the people who we serve. I've got an absolutely fantastic question to finish this off with that's come in from Heather, who is asking, have you ever been totally daunted by an emergency situation?
Yeah, great question. I mean, the answer is definitely yes. No matter how good your training is, and I had fantastic training when I first came to the service, and I think we equip our teams with really, really good tools to go out there and do the job. Some of the stuff that we face is inevitably pretty daunting. And I think the key thing is to view those as challenges that can be overcome. And it's much more about managing yourself when you're faced with a big challenge, some daunting situation, than about never finding things daunting. And as you go through your career, the times where you find something generally daunting decrease, but they never go away. I remember being stood underneath, at the perimeter of the fire at Grenfell Tower, looking up at that building ablaze and thinking, my God, what could we be faced with here? How bad could this be? And clearly it was absolutely dreadful. And I think those sorts of occasions are never going to be anything other than daunting.
Thank you, Tom. Now, I think between us, I think we've managed to squeeze about an hour and a half's worth of conversation into a very short space of time. Thank you ever so much for everything you're doing, and thank you ever so much. I know you're ridiculously busy, so thank you so much for spending some time to answer these questions that have come in from our supporters.
No worries at all.
And dear supporters out there, thank you ever so much for all your questions and continued interest in what we do. And just remember, we can only do what we do with your support. So thank you very much indeed.